Heart failure, a guide for patients. We are showing you this information because you have heart failure. We hope you will gain an understanding of your condition and learn how to manage it.
The heart is an amazing organ. Each day it beats nearly 100,000 times to provide our bodies with a steady flow of blood. When the heart pumps, its left and right sides contract or squeeze in unison. The left side of the heart pumps blood to the body, while the right side pumps blood to the lungs. Let's take a closer look at how the heart typically functions. The heart's main pumping chamber, the left ventricle, is located on the left side of the heart. The left ventricle pumps blood to the body, delivering nutrients and oxygen to all of our organs. After reaching the smallest of blood vessels in our bodies, called capillaries, and delivering its cargo of oxygen and nutrients, it returns to the right side of the heart. The right ventricle pumps this blood to the lungs, where it picks up more oxygen and gets rid of carbon dioxide. The blood then returns to the left side of the heart to begin this cycle all over again. Heart failure is usually a chronic progressive condition that causes the heart to weaken. So either it isn't strong enough to pump enough oxygen-rich blood to the body, or it doesn't fill with enough blood. Heart failure can affect the left, right, or both sides of the heart.
Heart failure is a serious condition in which the heart is not pumping blood around the body efficiently. The left side, right side, or even both sides of the heart can be affected. The ventricles are unable to fill properly or eject blood fully. With right-sided heart failure, the heart has trouble pumping blood to the lungs to receive oxygen. With left-sided heart failure, the heart struggles to deliver blood to the rest of the body. It can be said that heart failure is a cumulative consequence of all the insults to the heart over a person's lifetime.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster, and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak heart. The progressive effect of the heart failing to properly circulate blood and congestion due to fluid retention is known as congestive heart failure.
There can be many causes for heart failure. Diagnostic tests must be performed to find the cause for your heart failure and therefore the best way to treat it. Coronary artery disease is the most common cause of heart failure. Coronary artery disease causes obstruction to the coronary arteries, preventing blood flow and therefore oxygen delivery to the heart. Sudden or prolonged lack of blood flow to the heart muscle is the cause of heart attack, otherwise known as myocardial infarction. Heart attack can cause a weakening of the heart muscle. In response, the muscle grows bigger, but in turn works less effectively. Another cause can be hypertension, when the pressure inside the blood vessels is too high. As the heart pumps against this pressure, it must work harder. Over time, this causes the heart muscle to thicken and weaken. Diabetes increases the risk of heart failure and hypertension and may be a cause of cardiomyopathy. The risk of heart failure is largely increased in men and women who have diabetes. Cardiomyopathy is when the heart becomes enlarged and weakened. It can be caused by genetic conditions, a viral infection, excess alcohol intake, or other medical conditions. Valvular heart disease can cause heart failure. Heart valve disease occurs if one or more of your heart valves don't work well. These valves have tissue flaps which open and close with each heartbeat. The flaps make sure the blood flows in the right direction through the heart's 4 chambers and to the rest of the body. A hardened or narrowed heart valve restricts the flow of blood out of the heart. A loose and floppy heart valve can cause blood to flow backwards in the wrong chambers and therefore damage the heart.
Anything that causes damage to the heart muscle can lead to heart failure. Attempting to compensate for its decreased pumping function, the damaged heart remodels itself over time, expanding like a balloon, and the larger it gets, the more inefficient it becomes. This inefficiency has disastrous repercussions. Unable to pump out enough of the blood it receives from the lungs, pressure increases within the heart, and the system starts to back up. Fluids pool in the lungs, the heart itself, and throughout the body. This leads to swelling of the legs, difficulty breathing, and a high risk of sudden cardiac death.
A number of tests can be performed to find the cause of your heart failure and therefore the best way to treat it. Blood tests give an overall picture of your health, and they include BNP, which is specific for heart failure, thyroid function tests, renal function, electrolytes, complete blood count, and CRP if infection is suspected. Urine tests examine how well your kidneys are working. Poor kidney function may be a result of poor cardiac function. Chest X-ray looks at the size and the shape of your heart and lungs and shows any congestion which may be present in your lungs. In heart failure, the size of the heart increases and the lungs may take on fluid. ECG, or electrocardiogram, is a simple test which records the electrical activity of the heart. It can detect heart rhythm problems and damage which has been sustained by the muscle tissue. Echocardiogram is like doing an ultrasound of the heart. It looks at how the heart muscle is moving, how well the valves are functioning, and what percentage of blood is being pumped out of the left ventricle. Coronary angiogram is when a tube is placed in your artery and dye is released into the bloodstream. The arteries of the heart are visible on an X-ray, and blockages or narrowings can be seen by the doctors performing the procedure. These blockages contribute to heart attacks and angina and are classified as coronary artery disease. Other tests which may be performed include MRI, myocardial perfusion scan, and stress testing. Heart failure can be classed as acute or chronic. Acute heart failure is a rapid decline in a person's health and well-being related to the heart's inability to pump effectively. Management of acute heart failure depends on the cause. Primarily, we need to remove extra fluid with medications called diuretics, assist breathing with extra oxygen, and sometimes a ventilation machine. Chronic heart failure is an ongoing condition in which the heart is weakened and can't pump as well as it normally would. The National Heart Foundation of Australia says that while it can be life-threatening, you can control the symptoms, avoid unnecessary hospital visits, and live a longer, healthier life by taking charge of your condition and working in partnership with your healthcare team. There can be many symptoms associated with chronic heart failure. You may not experience all of the symptoms, and those you do notice may range from mild to severe. If you experience any new symptoms, or if symptoms get worse, or you are worried, then please speak to your doctor or your heart failure nurse. Most common is shortness of breath, as the weakened heart results in excess fluid buildup of the lungs. Persistent cough, sometimes with white or pink phlegm. Swelling of the abdomen or legs, which is known as peripheral edema. sudden weight gain from fluid retention, nausea, fatigue, difficulty concentrating, heart palpitations, and chest pain or discomfort. Cardiac chest pain can be vague and different for each person. It could feel like tightness, fullness, pressure, squeezing, heaviness, or pain in your chest, neck, jaw, throat, shoulders, arms, or back. People with chronic heart failure often have other forms of heart disease that may restrict the flow of blood to their heart muscle, causing temporary chest pain, tightness, or discomfort. If you experience any chest pain or discomfort, immediately stop what you are doing and rest. If you have been prescribed GTN spray or angionin tablets for angina, take these as prescribed and see if the pain disappears. If the chest pain is not completely resolved in 10 minutes, or if it suddenly gets worse or is associated with palpitations, then call an ambulance by dialing 000. Heart failure is a serious condition that progressively gets worse over time. However, it can be controlled and in certain cases reversed with treatment. There are a number of treatments which can relieve the symptoms and stop or slow the gradual worsening of the condition. Heart failure therapies aim to relieve the symptoms and improve quality of life, slow disease progression, reduce the need for emergency room visits and hospitalization, help people live longer. A number of medications are prescribed for heart failure, and most patients will take more than one type. Some of the medications include ACE inhibitors, which reduce blood pressure, dilate blood vessels, improve blood flow, and make it so the heart doesn't have to pump as hard. Beta blockers lower blood pressure and control heart rate. Diuretics help the kidneys produce more urine and rid the body of excess fluid. Spironolactone is another diuretic that has been shown to reduce the number of hospitalizations required and prolong life when used to treat advanced heart failure. Potassium and magnesium supplements are prescribed as the diuretics tend to flush these minerals out of the system. Digoxin makes the heartbeat stronger and slower, and antiarrhythmic drugs treat abnormal heart rhythms. Along with medications, there are lifestyle changes which are recommended. These modifications often improve or control some of the factors contributing to heart failure. It is recommended that you modify daily activities so you get enough rest, eat a heart-healthy diet that is low in salt and fat, don't smoke, don't drink alcohol, or limit the intake to no more than 1 drink 2 or 3 times a week. Lose weight, avoid or limit caffeine intake, get regular exercise, which may include some physical rehabilitation programs, reduce stress, weigh yourself daily for a sudden increase in fluid buildup, keep track of symptoms and report any changes, and have regular check-ups to monitor your condition. Treating heart failure should focus on treating the underlying cause. Coronary artery disease is the most common cause for heart failure. Coronary artery disease causes obstruction to the coronary arteries, preventing blood flow and therefore oxygen delivery to the heart muscle. Angioplasty uses a small metal stent to open a blockage in an artery. This is done in a similar way to an angiogram. Coronary artery bypass grafting is an option when there are too many blockages for stents to be used. During bypass surgery, blood vessels are taken from another part of the body and are used to link a good artery to the remaining good parts of a diseased artery. Sometimes a pacemaker or AICD may be needed. When the heart's contractions become out of sync, the left ventricle is not able to pump enough blood to the body. In the normal heart, the heart's lower chambers or ventricles pump at the same time and in sync with the heart's upper chambers or atria. When a person has heart failure, often the right and left ventricles do not pump together. A biventricular pacemaker can improve the symptoms of heart failure in about 50% of people who have been treated with medications but still have severe or moderately severe heart failure symptoms. A small pacing device is inserted into the chest and connected to wires implanted into the heart's two ventricles. It discharges an electrical current which keeps the right and left ventricles pumping together. An automatic internal cardiac defibrillator, or AICD. Some people with heart failure are at risk of fast, irregular heart rhythms, some of which can be life-threatening. Similar to a pacemaker, an AICD will give a stronger electrical shock to the heart and set it back to a normal rhythm. As discussed with the methods of treatment, the key to preventing heart failure is to reduce your risk factors. You can control or eliminate many of the risk factors for heart disease, such as high blood pressure and coronary artery disease, by making lifestyle changes along with the help of any needed medications. Lifestyle changes you can make to help prevent heart failure include not smoking, controlling certain conditions such as high blood pressure, staying physically active, eating healthy foods, maintaining a healthy weight, reducing and managing stress. Management of your condition at home involves restricting your fluid intake to the amount prescribed by your doctor or heart failure nurse. A weakened heart cannot process excess amounts of fluid. The recommended amount is usually less than 1.5 litres per day. Weigh yourself every day and chart or graph the results. You must seek medical advice if your weight goes up by more than 2 kilograms in 2 days. Restrict salt intake. Choose foods which are less than 120 milligrams of sodium per 100 grams. Take medications as prescribed and avoid anti-inflammatory and non-prescription medications unless you have discussed these with your doctor. Vaccinate against influenza. Follow guidelines about exercise and diet. Aim for 30 minutes moderate intensity physical activity each day. Eat a healthy diet with plenty of fish and fresh fruit and vegetables. Contact your GP or your heart failure nurse within 24 hours if you notice the following signs or symptoms: increased shortness of breath on exertion or at rest, increased swelling in ankles, feet or abdomen, inability to lie flat, dizziness or lightheadedness, palpitations, new or increasing chest discomfort, persistent cough. New York Heart Association classified heart failure based on the relationship between symptoms and the amount of effort required to provoke them. This may give you an indication of the severity of your disease. Class 1 patients have no limitation of physical activity. Class 2 patients have slight limitation of physical activity. Class 3 patients have marked limitation of physical activity. Class 4 patients have symptoms even at rest and are unable to carry on any physical activity without discomfort.